Very good afternoon to everyone. Let us wait for a few more minutes. I can see a few people joining our session today. A very good afternoon, everyone. On behalf of Futurist Insurance, I, Kirtana from the marketing team, welcome you all for today's special webinar on cancer awareness. Today's session is about the importance of cancer awareness and why early detection and prevention can make a big difference. Cancer cases are rising across all age groups, and many of us overlook the habits and risk factors that lead to it. This session will help us understand how awareness, regular screening, and better lifestyle choices can protect our health and the health of our loved ones. I am so happy to introduce our guest, Dr. Kanika Sood Sharma, who is the Director and Clinical Lead of Radiation Oncology at Dharamshala Narayana Hospital. Dr. Kanika is an MBBS gold medalist with an MD in Radiation Oncology. She's trained at the Regional Cancer Center in Shimla and completed her senior residency in Maulana Azad Medical College, along with her special training at IRCH and AIMS Delhi. She has a wide experience in advanced cancer treatments and has a special interest in Bharti therapy. She has presented her work internationally and received the Best Fellowship for Doctors aged less than 35 years award. She focuses on gynecological, GI, and breast cancers, as well as preventive oncology. We are glad to have her with us today. I now invite Dr. Kanika to begin the session. Over to you, Dr. Kanika.
At the outset, I thank you for such an elaborate introduction. Thank you so much for having me here for this session. Awareness is one of the topics which is really close to my heart because as oncologists, we do get a lot of gratification in treating patients, curing patients. But as a responsibility, I think it is important that we first of all try to ensure that community does not have high number of cancer cases. So there are so many things which can be done in our lifestyle, very, very simple things, which if one adopts can reduce the risks of cancer. So that is what we will be talking about today. And I will briefly share with you the overview of your lifestyle choices, which can help you in preventing cancer. So I hope you can see my slide deck. It's just, the pictorial representation will give you a long-standing impact than just my, verbal dialogue here. So firstly, the scenario in our country is bad in terms of cancer because we have a lot of awareness, lags. People are well educated, but despite that, nobody wants to really read about cancer. Maybe we have created a lot of stigma around this disease that people fear talking about it. Or there is a false mindset also. I think a lot of people think that cancer happens to a particular type of people who are smokers and drinkers and have, cancer in their family. But that is not true, as you will understand from my presentation today. The third factor, because our country is diverse, there is a great amount of polarization. There are people who are living in the urban areas who are much more closer to the healthcare facilities, are more aware compared to people in the rural area where the 75% of our population actually resides, where the healthcare access is limited. And lastly, but very importantly, there are lots of myths and taboos. Since this is a disease which is feared, people have created a lot of false information around these diseases. And secondary to that, a lot of people fear coming to the hospitals. And these misconceptions have also been a big barrier for cancer awareness. So I will try to bust a couple of myths also today so that, you are well apprised of what is the true reality and what are the facts. So let's try to, fill this knowledge gap today a little bit. and understand that why we should talk about cancer. Firstly, it is one of the most, I would say, rising health concern, because in last one decade itself, we have seen that with every passing year, the number of cases of cancer are on a rise, and the situation is such that there are a lot of medical literature which is predicting that in coming 10 years, the number of cases is going to be so much that healthcare facilities may not have sufficient resources to handle this amount of cases. So we need to understand about this disease because it's a leading cause of death also. In India, the top three reasons why which people die are heart problems, cancer, and roadside accidents. So cancer is one of the three killer problems of our country. And more importantly, there are almost 50% of cancers which can be prevented. That is why it is important to understand about it. And finally, as our host had mentioned, that it is the early detection which is important. So if you understand the disease, you know the symptom, you might pick it up even in a precancerous condition, or you may pick it up in a scenario where the treatment is just a single modality of treatment, like a small surgery or a short course radiation, or just some immunotherapy or chemotherapy. So that is the importance of awareness. So let's talk about this disease, which is very secular. It does not differentiate it between a man, woman, poor, rich, child. No age group is spared. So one should not live with this false mindset that cancer happens to a particular set of people. So anybody can get cancer. But in our country, what we are seeing is that apart from the increased number of cases which we are seeing year by year, the younger generation is coming more common. So it is a known scientific fact that we see our patients almost a decade earlier than the Western world. For example, if breast cancer is happening more in women aged more than 50 years in US, we are seeing women even in late 30s and early 40s a lot in our country. So that is the changing trend. And year by year, as I had mentioned, the number of cases are on a rise. I remember when I started training as a student, we used to say 5 to 6 lakh cases every year we are seeing new. And now this year projection is 16.5 lakh. Last year was already 15.5 lakhs. And almost more than, a third of the patients which we see would have some role of tobacco in causation of cancer. Breast cancer has increased. The numbers used to be around 1.5 lakhs in a year. It crossed 2.2 lakhs last year. So the breast cancer cases are on a rise. And for women, particularly, cervical cancer still remains to be a huge health burden. And the sad thing about our country is that uh, the numbers are rising, but at the same time, the patients do not approach doctor in time. It is known that almost 70 to 80% of patients reach the healthcare facility when they're already in stage 3. And as I mentioned, more younger patients are afflicted. So the patients who are dying with cancer in our country, less than 70 years of age, is huge compared to the Western world. And the small children, the minors, are also having much higher incidence of cancers in our country compared to the Western world. So all these things are alarming. And this is how, cancer patients present to us. I don't want you to fall into the statistics trap, but you can understand, irrespective of any cancer, breast cancer, cervical cancer, head and neck cancer, or lung cancer, most patients are coming to us in stage 3. So before understanding the risks, the preventive measures, first let me briefly tell you what cancer actually is. So cancer happens when one cell is not dividing the way it should. Normally, a cell should divide into two, which is the normal cell biology. And if there is a defect in the cell, the body kills it because of certain mechanisms, which are check mechanisms, like the tumor suppressor genes. But in cancers, these tumor suppressor genes become defective and the cancer cells start to divide uncontrollably. The numbers are like a chain reaction in a nuclear fission reactor. And cancer can happen to any part of the body. It is not that only breast cancer or lung cancer or liver cancer. Right from skin to any organ in your body, cancer can afflict any organ, including bones. And this particular slide would actually showcase the major causes, and it is the most important slide. If you understand the risk factors, I think you will yourself understand what changes need to be done, what are the cautionary areas where you need to really work upon so that you can reduce your and your loved ones' risk of developing cancer. So if you look at this pie chart, you see the biggest chunk which has been mentioned is diet and tobacco. So tobacco, as I had mentioned, is responsible for almost 1/3 of cancers which are happening to the people in our country. And it is not just a cigarette, not just cigarette bidi, it is the chewed tobacco. In our country, we see a lot of people use the pan masalas and chewed tobacco, which is responsible for causing cancer not only for the mouth, but also throat. And when they swallow this contents and it percolates into the body, even kidney and many other organs can get tobacco-related cancer. Talking of alcohol, which is also commonly used in people who are consuming tobacco or independently, alcohol in itself also independently can cause around 7 to 8 different types of cancer. So tobacco and alcohol, one big culprit. Diet-wise, we talk of a diet which is deficient in fiber, it is deficient in fruit, it is full of processed carbohydrates. That is the diet which is bad. If you are using a lot of fruits and vegetables in your diet, you are consuming more proteins, less processed carbohydrates, less preserved foods, that is a good way of maintaining a good lifestyle, and it reduces your risks of getting truncal obesity also. People who have fat around their tummy, पेट का मोटापा, they are predisposed more to certain cancers like breast cancer, uterine cancer, prostate cancer, and cancer of the big intestine or the colon. So diet and your body mass index and your truncal obesity have a close association when we talk of cancer causation. Next comes sexual practices and viruses. So there is a big segment of viruses called the human papilloma virus, which is sexually transmitted from a man to a woman. It is responsible for almost 8 to 10 different types of cancers. So the cancers most commonly which can happen because of HPV are the cervical cancer. Cervix is the mouth of the uterus, cervical cancer, the vaginal cancer, vulvar cancer, anal cancer, penile cancer, throat cancers, oropharyngeal cancers can also be caused because of the human papilloma virus. So viruses also are causative. So it is important that appropriate vaccines should be taken at the age which is prescribed. I will talk about it in one of the slides to reduce the risk of cancer causation. Then there are certain things in our environment, like industrial exposures or the air pollution or the presence of a lot of preservatives or fertilizers in our food chain. These are also responsible for rising cases of cancer. And finally, as you may see in the slide, family history. You see, family history is a very, very small proportion. Only 2% of the causation is related to your genetics. Though for certain cancers, the prevalence of genetic history is higher, like breast cancer, prostate cancer, or ovarian cancer. But in general, when we look at the entire basket of the cancers, the genetic history is contributing in cancer causation in only 2%. So that is the importance of understanding that you should not live with this wrong mindset that cancer happens only to those people who have cancer running in their family. Even if there is no patient of cancer in your family, you still have the risks which you have to identify and try to mitigate. So before we go to individual cancer symptoms and risk factors, let's first, bust some common myths around cancer as well. So firstly, cancer is not communicable. A lot of people feel that, sitting with a cancer patient or cohabiting with a cancer patient puts you at risk. Cancer patients are very safe. It is just that their immunity is lesser, so we want you to keep them a bit isolated so that they don't go into crowded areas where they can catch up infections. Otherwise, they are not anyways harming anybody, people around them. They are absolutely safe. Rather, they are the ones who need the maximum, attention and care when they're going through their treatment. All cancers, as I'd already mentioned, are not hereditary. Only certain cancers are hereditary. Cancer is not a death sentence. Many people feel that if it is once detected somebody has cancer, it is deemed that that patient will die of that disease. Even in today's time in our country, we see a lot of survivors doing very well after effective cancer treatment in time. A very simple example is, cervical cancer. When we started training, our textbook survival rate said that stage 3, only 40% of patients can survive. But now we counsel our patients with a lot of confidence that 80 to 90% chance that even in stage 3 of cervical cancer, you will be fine. So the treatment outcomes are improving, our technology is improving. So it is just the timely treatment which is important. Otherwise, cancer, if detected well in time, is not something which will lead to death because of that disease. Then another myth, which is very common, and it is also one of the facts that patients come to us late, is that presence of pain. Many people feel that if they are having some ulcer in their mouth or any swelling in their body and it is not painful, then it is not cancer. But it is not so. It is the other way. Cancer causes pain only when it gets very advanced. To start with, the cancer lumps, swellings, or ulcers are painless. Then there is a myth that, cancer is because of your karma. So I would say we need to know what karma are we talking about. It is not about your, emotional karmas. It is about your lifestyle. It is a lifestyle. If it is your bad lifestyle, that is the karma which may bring the risk of cancer, but not your, other spiritual or emotional karma which can contribute towards causation of cancer. Then I think briefly touched upon that there are many forms of tobacco which can cause cancer. It is not that any cigar is safe or hookah is safe. Be it hookah, be it cigar, be it shisha, be it chewed tobacco, each one of them bears risk of cancer causation, and there is a category 1 evidence, a very, very strong evidence to confirm this fact. Then hair dyes, deodorants do not cause cancer. So there are certain hair dyes which have ammonia which can cause blood cancers. And deodorants per se do not cause cancer, but prolonged usage of any chemicals, you never know, because even the knowledge which we have accumulated is certainly limited in certain scenarios, including usage of deodorants. But any chemical which you are using for a long duration is harmful. For example, there was a study which came in a couple of years back that people who are getting their hair keratin done very frequently, the hair straighteners are increasing the risk of uterine cancer. Or the UV rays which are used for the gel nail paints, these are responsible for skin cancer. So please choose things judiciously. Moderation is the key. I would not say that you really need to dissociate yourself from everything and not, do anything which makes you feel happy socially. But you have to choose right things, and moderation is the key. And this is the study I was talking about, that hair straighteners and relaxers can cause uterine cancers. So after busting these very common myths, now let us understand the warning signs. We know the risk factors. Now we need to understand what are those warning signs which you should be aware of, so that in case somebody is encountering these symptoms, you can pick them up early. So if you can remember this mnemonic caution, it covers practically all the symptoms which cancer can have. Change in bowel bladder habits, any sore which is not healing, any discharge or bleeding from your body which is not explained by any physiology. Lump or thickness. Lump is a swelling or guilty gland in breast or armpit or neck. That is something which needs medical attention. Indigestion, particularly if you are encompassing difficulty in swallowing. For example, you are normally eating solids, but over a period of time, you require a lot of water to gulp down your food, or even semi-solids are getting stuck. That is difficulty in swallowing. Then if you have any wart or mole with till hai ya massa hai, which is changing in its shape, color, dimension, or its edges are getting very fuzzy or irregular, that can be a skin cancer and needs to be shown to any doctor. Nagging cough and hoarseness. If there is a long-standing cough which is lasting more than 3-4 weeks, and your routine medication has not helped in curing it, can also be indicative of some underlying disease which can be cancerous also. So I'll talk about certain common cancers also so that you are more specifically understanding them. For lung cancer, risk factors include air pollution and tobacco consumption. Even shortness of breath, सांस फूलना, छाती में दर्द होना, weight loss, especially if you are having more than 10% of weight loss in 6 months, and it is not because of your efforts, it is unexplained, that can be an underlying malignancy, including lung cancer. Colorectal cancer, badi आंत के cancers. These are related to consumption of less fiber, more fatty food, more red meats, being smoker, and not exercising. And symptom wise, if somebody is having constipation, which is alternating with diarrhea or encompassing blood in the stool, and many people feel that it is piles. Many times I see patients who have been treated for piles for a year or so, and suddenly we come to a realization that it is not piles, but it is an underlying malignancy. Because patient has self-medicated, so the doctor has not seen for that reason. Sometimes patient does not really get a true diagnosis and comes to us in stage 3 with this disease. Bloating, पेट फूलना, extreme weakness or anemia can also be because of colorectal cancers. Prostate cancer, it is a cancer of men, usually happens after 50 years of age, and more so in those men who are obese and who are again consuming a diet which is less in fiber, lot of fatty food, alcohol, smoking. And major symptoms are difficulty in urination. Either urine is not coming, it is getting stuck, obstruction, or the stream of urine is weak, or one has to go multiple times for urination to avoid urine. Sometimes there can be blood in urine and in blood in semen as well. And if it is ignored, then it can spread to the bones, lead to bone pain, backache. All these symptoms can have a shared diagnosis with benign cancer, prostate hypertrophy also. So I would here again want to reassure you that all symptoms may not be same for cancer. Sometimes non-cancerous conditions can also give you similar pictures. So don't self-diagnose yourself. If you feel any of these symptoms, they need to be medically confirmed. Head and neck cancers. Head and neck cancers include cancers of our throat, our palate, lips, cheeks, voice box. And common symptoms are change in the voice, any ulcer which is not healing, blood coming from the mouth, uh, halitosis, bad odor which is not going by brushing or mouth washing. And or you're feeling some swellings in the neck. We call them lumps or lymph nodes in the neck area. That can be a symptom of head and neck cancer. Breast cancer happens mainly in women, but men can also get breast cancer. But major cause for breast cancer seems to be genetic in around 8 to 12% of cases. Lifestyle-wise, women who smoke, who consume alcohol, are obese, are at a higher risk. So are the women who have their first child late or do not have children. Women who are nullipera or get first childbirth after 30 years of age are at a higher risk of developing breast cancer. Symptom-wise, majorly it can be a lump in the breast, asymmetry of the breast, the shape of both the breast not being similar. Sometimes from your adolescence, mild the asymmetry may be there, but if there is a discernible recent onset asymmetry, it can be because of breast cancer. Pain in the breast or blood stain discharge. If there is a blood discharge from the nipple, that is something which is of concern and should be shown. Here again, I would want to reassure you, many a times during your, menstrual cycles, just prior to the onset of cycles, you may feel lumpiness or heaviness in the breast, or there are sometimes non-cancerous lumps also like fibroids. So don't panic. Uh, these cancers can, mimic many other conditions. So do not self-diagnose again. I'm repeating myself because this is what is happening. I see a lot of young women, feeling a lump, Googling and then panicking and coming to me with breast lumps. So you need to understand that something which comes and goes with your cycles may not be cancerous. But if there is a lump which is consistently being felt by you, is not painful, is irregular, and is increasing in size, it can be a breast cancer. Cervical cancer majorly happens to women who are multipara, who have had multiple children or have multiple sexual partners, or have had immune deficiencies like HIV, that they're at a higher risk. But smokers are also the ones who are at high risk. And major symptoms can be irregular bleeding, which is not happening between your periods, or prolongation of your normal periods, or foul smelling discharge, swelling in the legs, backache, and constant fatigue. And the most commonest symptom, or the first symptom, is bleeding after sexual intercourse. We call it postcoital bleeding. That is the first sign of cervical cancer. So after understanding, the risk factors and the symptoms, now let us see what can be done to pick it up early. Because when we pick it up early, the cure rates are better, and that is the good thing which is happening. The survival rate, as I had mentioned, even for stage 3 diseases, has enormously increased, and treatment outcomes are improving. So what is in our hand, apart from adopting a good lifestyle, is screening. So screening means doing certain tests, not when you're ill, doing certain tests when you're absolutely healthy and fit. These are tests which are trying to look for hidden diseases. So what are these tests, and how we need to do them? So these are the recommendations which I'm sharing for those people who don't have family history or high risk features. So screening includes physical examination, where a doctor examines your body. Whatever organ can be felt with hand can be examined. Certain blood tests and certain imaging may be ordered. So from imaging, mostly what we do is, for women, we would recommend a mammography. Mammography is an X-ray of the breast, which is started mostly at 45 years of age. Because before 45 years of age, that mammography picture does not give you a clear image. So if somebody has to start screening earlier because of genetic history, then we do ultrasounds or MRIs. So the recommendation as of now is that from 45 years of age, every year a mammography should be done till 54 years of age. After attaining the age of 54 years, then this test has to be done once in every 2 years till around 70 years of age. So it is picking up very, very small, specks of tumor also. Even a small calcification of 3-4 millimeters can be picked up. So that is the advantage it gives. And in case we pick up a tumor which is less than 2-3 centimeters, we need not remove the entire breast. We can do conservative surgeries so that the cosmetic outcome as well as the survival outcome both are maintained in the patient. Apart from doing mammography, one thing which we recommend is self-breast examination. Self-breast examination means that once in a month, you yourself are examining your breast to see for any lumps. So any woman who's above 18 years of age should learn self-breast examination. It should be done once your periods are over. Do not do it when your periods are going to start. As I had mentioned, you will feel heaviness, lumpiness at that time. So it is to be done around 4-5 days after your periods have started. Breast will be softer. Mainly, our intent is to see certain changes which are happening. So what could be those changes? There may be skin changes. So to observe that, expose yourself till waist, stand in front of a mirror, see whether both the nipples are at the same level, they are not asymmetric. When you lean forward, both breasts would fall forward, same, not that one is remaining behind. So these are early things which can be picked up. And then finally, with the flat of your hand, you have to press the breast with the chest wall, and from top to bottom, from left to right, the entire breast, armpit, and behind the collarbone should be examined. So during this examination, if you feel something new which you were not feeling previously, needs to be shown. But again, do not fear. Many times you may feel some hormone-related glandularity, which can be cross-checked with the doctor to reassure you that it is not malignant. Next important screening test is Pap smear. Pap smear is the screening test we do for cervical cancer. This is not a self screening test. It needs to be done by a gynecologist. And it is recommended that once you are sexually active, it should be done once in every 3 years, till 65 years of age. Nowadays, with this Pap smear test, we sometimes do another test called the HPV DNA test. If that also has been done and is negative, then the frequency of test can be made to once in 5 years. Women who've undergone hysterectomy for non-cancerous condition, they can omit this test. Otherwise, we would want this test to be done for all women. Along with screening, as I had mentioned, since human papillomavirus is the culprit for causing cervical cancer, we have a very, very effective vaccine which is available against this virus. And this is a schedule which I have mentioned. Ideally, it should be done before 15 years of age. It is a gender-neutral vaccine. Both boys and girls are eligible for it. If it is given before 15 years of age, then only 2 dosages are required. If the vaccine is given after 15 years, then 3 dosages are required. There is no advantage of the vaccine after 45 years of age. So that is why we recommend that ideally it should be done in children before 15 years of age because efficacy is more. The protection it gives is to the tune of 95% when it is given in childhood. And this drops down to almost 70% if you are giving it after 40 years of age. So if you have children in the family who are eligible for it, do speak to your pediatrician for this particular vaccine. Next is oral screening. Oral screening is for people who chew tobacco. Although I firstly say that ideally do not chew tobacco. If you're a tobacco chewer, you should try quitting it. But if somebody chews tobacco, one should, while brushing teeth, check the entire cheek, the gums, the tongue, the palate for any red or white patches because these red and white patches are precancerous condition. So finally, after understanding screening, you also need to understand what you can do in addition to prevent this disease. So as the risk factors have been well understood, you have to address those risk factors. So start eating healthy. Healthy means incorporation of fruits and vegetables in your diet, exercising regularly, avoiding alcohol and tobacco. For exercise, the WHO recommends at least 180 minutes of exercise through the week, which is protective and ensures that your risk of dying of lifestyle diseases is reduced by 50%. Avoid these carbonated, calorie-rich materials. These are not giving any food value to you. They are purely, sugar-giving products, and sugar is presumed to be the next poison after tobacco in a lot of lifestyle diseases. So maintain a healthy body weight and avoid processed food. Do not smoke. And smoke, as we know, smoking is not something which is a taboo. It is prevalent in all segments of our society. Maintain a healthy body weight and try to protect yourself from harsh sun rays also. If you are expecting, exposure to harsh sun rays, use sunscreens or cover yourself to protect yourself from skin cancers and follow the screening recommendation. And do not think that cancer happens to others. Cancer can happen to anyone. If it does happen, there is a lot of armamentarium available, and one should not panic or run away because, as oncologists, it is really painful to see that sometimes patients are, sitting with the diagnosis for 8-10 months because of the fear, and by that delay, they increase the stage of the disease and their chances of cure. And cancer is not incurable, as I've mentioned that in today's time with newer linear accelerator-based targeted radiations, immunotherapies, CAR T therapies, there are a lot of advances which are happening to improve the outcome in our cancer patients, whether it be survival or quality of life. So that is it from my side. I would be happy to take questions. I hope I was able to give you an overview of what cancer is and how we can protect ourselves. I will be stopping sharing my slides. And over to you, Kirtna, and I would be happy to take questions.
Yes. Thank you so much, Dr. Kanika, for such helpful and insightful session. And as Dr. mentioned, the floors are open for Q&A. Doctor, I think we already have a question in the chat box. So they ask, what about carbide used in fruits like mango, papaya? Do they cause cancer? Is what they've asked.
Yeah, I think this is something which was quite a lot in circulation in last couple of weeks. We could see a lot of news clippings and reels circulating around it. So yes,
Yeah.
fertilizers and pesticides have carcinogenic potential. It is the quantity and it is the exposure duration which matters. all, as I had put in one of my slides, as I had mentioned, environmental exposures, the fertilizers and pesticides coming in our food chain. So these are those, which are few are being used to ripen the fruits, few are used to, take away the pests away from them. So any amount of chemical which is coming into your body over years can cause harm, and it can be as bad as in causing cancer as well.
Thanks, doctor. So we also have another question. So they've asked, does people having diabetes are prone to more cancer is what it is.
So it is not just diabetes alone. A particular subset of patients, especially women who are obese, who are diabetic, who have hypothyroidism, are at a higher risk of developing uterine cancers. So we call it corpus triad syndrome. So these three particular metabolic disorders are making the woman more prone towards uterine cancer. So not diabetes per se, but if a diabetic is obese and as is in harboring other diseases like hypothyroidism, the risk then increases, but not independently because of diabetes.
Okay, doctor. So the next question is, what screenings should we be getting for a general cancer screening and how often it should be done?
So see, we determine the screening based on your risk profile. When you go for a health checkup, doctor will determine your age, your family history, your lifestyle, whether you're sedentary, are you a tobacco user, have you been vaccinated for HPV. So based on that, we recommend the screening test. In today's time, we have few diseases for which effective screening is available. I've already mentioned breast cancer. I've mentioned cervical cancer, for which screening is available. Lately, a new thing which has been added is a low dose CT scan, which previously was not recommended for lung cancer screening. But after COVID times, it has been determined that very low dose chest CT scans are safer. So if somebody is a smoker or has been a smoker for a duration of more than 10 years, is eligible to go for screening for lung cancer by low dose CT scan as well. For men, uh, there is some rule of doing PSA testing after 50 years of age, but it has a caveat to it because PSA is not very specific. Age-wise, although there is a lab range ascribed to it that 4 nanogram is the upper limit, but sometimes due to infections, sometimes in people who are 70, 80 years of age, it might rise borderline. So it has to be further validated by another tests like ultrasounds or biopsies to confirm. So PSA is a screening test, but it has to be done cautiously under the supervision of a doctor. Then, as I had mentioned, oral screening, physical examination is what we would recommend. So if there are, we find that in this interaction that you have a strong family history, then we might ask for certain genetic tests also. For example, if there is a woman and we see that her aunt, her maternal aunt or uncle have had uterine cancer or pancreatic cancer, we might ask for BRCA testing, which is a genetic testing, BRCA testing. So that again is a sort of a screening to determine whether you also harbor a mutation and whether you should also, your surveillance should be more stringent. Because guidelines of surveillance and screening change if we find certain genetic anomalies which are attributed in cancer causation. So more so it is this, and a routine blood test we recommend, and few tumor markers are seen in certain blood tests, but this again is not a routine. For ovary, if we find that there is a genetic history, there is a test called CA125. We will combine it with a transvaginal ultrasound for screenings. People who have had family history of pancreatic cancer, CA19.9 or CA15.5. So there are certain tumor markers also. The cancer cells, they shed certain antigens which circulate in the blood. So with the blood test, but these are not standard screening which is recommended across the table. We will determine who is eligible for that. A lot of research is happening. People are working on circulating tumor DNA cells, and it is something which is under validation. Although few people have already made it commercial, and we are not very, happy with that fact because interpretation of unvalidated tests is not right. So ctDNAs, they take a blood sample, and in the blood sample, if we find that there is a tumor DNA circulating, it is indicating that somewhere there in your body there is some tumor. So the task starts there, where it is and what it is. That is why right now it is not something which again we offer across the board. But I think in our lifetime, or maybe in another 5 years, we might be able to pick up cancer in its very, very nascent stage by these ctDNA based screening tests. So that we are almost on the verge of, finding more and more early detecting tools in our gamut.
So let's move on to the next question. So, if a person gets any type of cancer, what process he or she should follow? That's the
So,
question.
right. So once anybody is diagnosed with a cancer, firstly, one should go to a center which has all modalities under one. So if you're seeking cancer care, we don't want biases, right? I'm a radiation oncologist, then person who does surgery for cancer is a surgical oncologist, a person who does chemotherapy for cancers is a medical oncologist. So if you're going to stand alone centers, there is a bias. It is an inherent bias. So cancer treatment is multimodality, all things under one roof. So go to centers which have everything under one roof, because their treatment culture is tumor based, because there they will discuss your case with all concerned stakeholders, and a treatment plan will be charted with. So identify centers where you would find such practices. The first step which we do if we suspect cancer is we do a biopsy, because with the biopsy we would know what is the type of cancer and what is the likely biology which will help us in making treatment decisions. Once biopsy has been done, based on what the cancer is, sometimes we do MRIs or sometimes we do PET CT scans. These tests are done to ascribe a stage, because for cancer we need to know what is the type of cancer, what is the stage of cancer, and based on that the treatment will be given. So the major tests would be run by oncologists. So once it is clear it is cancer, meet an oncologist. Otherwise, if it's just a suspicion that you feel there is something wrong, you can meet your family physician, you can meet your gynecologist. You need not run to the oncologist right away if it is just a fear or if it's just a doubt. But in today's time, there is a very, very clear algorithm for each cancer. We know step by step how it is done. So the only thing is that you should be approaching centers where oncologists have a tumor board based or a joint discussion based treatments.
Got it. So, moving on to the next question. Does blood in the stool on the occasional constipation require further investigation?
Yes, yes, absolutely. If there is if there is blood in the stool, it can be because of multiple reasons. It may not be cancer all the time, but it can be because of big intestine cancers, anal cancers, even stomach cancers. If there is a massive bleed, there will be black colored stool. So you should meet a gastroenterologist. The gastroenterologist might do a simple stool examination, maybe give you some medicines and do a rectal examination. If it is piles or any hemorrhoid related thing, the medicine should work and the problem should resolve. Sometimes bleeding can happen because of fissures also. A very hard stool can cause a tear in your anal passage, which will be painful also. So for that, once treatment is instituted and it is cured, then the bleeding should not recur. But any blood in the stool, I think at least you should see the doctor to rule out other causes. Because many times this is very common scenario. A lot of our patients are being treated for piles for years before actually establishing that it was a cancer which was missed or which was, presumed hemorrhoids.
Got it, doctor. So, are the preventive tests mentioned for early diagnosis of cancer are cost effective?
Yes, what happens is whenever we recommend these screening tests, there are certain, agencies, research bodies analyze it. For example, I'll just give you an example of breast cancer. So previously we used to recommend mammography from 40 years of age. Now we've moved the age to 45 years because the US Task Prevention Group, UCPTCF, they determined that it is not cost effective from 40 to 45 years age. We are overdoing it in that age because that is not the age where it is contributing to early detection to that quantum. So all these tests have been vetted through this exercise of determining their cost effectivity. Then only they are put across the board. Once it is coming in the guideline, that assures that it has run through the process of understanding how many lives we are saving per test and all that.
Got it, doctor. Thanks. So, we have another question. Is it possible to return to a normal lifestyle after being diagnosed with stage 3 or stage 4 cancer?
So, see, it all is determined by the extent of treatment and your own physical well-being, how many comorbidities you have. For example, if I talk of a breast cancer, uh, it is typically very different by different biology. For stage 3, one woman may require a year of treatment. If she's HER2 positive, she'll require 1 year of treatment. So 1 year is exhausting. And nowadays, for even for low risk, we are doing CDK treatments, which are lasting 2 years. So the quantity of treatment determines what will be your convalescence or your recovery cycle. If it is a stage 1 breast cancer, we know it's a simple surgery, and maybe a hormone, and you're ready to, to be at your workplace within a month. But treatments which require 6-8 months of consistent treatment, then I see patients even, at 8 to 10 months saying that our energy levels are not as good as they were before we were diagnosed with it. With a little bit of fatigue or some numbness or tingling in hands and feet, which are sequelae of certain chemotherapies, can persist up to 8 to 9 months.
Got it. Got it, doctor. So we are moving to the last two questions that we have. So there's a person who said that his mother has been diagnosed with breast cancer at fourth stage. What precautions should we take to prevent ourselves, is what he's asked.
So see, from the mother's side, it is not communicable, as I had mentioned. But as a family, since there is one family history of genetic cancer, you have to start your own screenings also in time. So if you have sisters uh, and daughters, and her sisters, your mother's sisters, they should go for their regular mammography yearly interval till the age of 65 to 70 years, and self breast examination. These are the two things. If there have been other family members also in the family who have had, in the maternal side, these cancers, then you need to meet a genetic counselor who will determine whether there is some genetic association, and then some testing might be required. Apart from that, maintain a healthy body weight, do not smoke, do not consume alcohol. If there are girls who are eligible for marriage, try to have first child by 30 years of age. All these are protective.
Got it, doctor. So we are moving to the last question. So, how about using plastic water bottles, plastic lunch boxes, or any plastic containers, food containers?
Yeah.
So,
Yeah, I believe, almost from last 15-20 years, we had this St. Hopkins WhatsApp message in circulation that heating food in plastic releases dioxins and is cancerous and all that. So, see, there are evidence that when you're using not food grade plastics, microplastics enter your body. So microplastics are having detrimental effect on your body in terms of causing a lot of hormonal disbalances. Incidence of PCOD and many other metabolic disorders is higher when a lot of these microplastics enter your body. The evidence that it causes cancer is not category 1. It may or may not is still under investigation, but we classify cancer causing agents as category 1, 2, or 3. It does not qualify as such in category 1. So there is no mention as category 1. However, we as oncologists do recommend that in general also reduce plastics in your life. I am a very strong proponent. My children do not have a single piece of plastic in their bag, whether it be the tiffin, whether it be the bottle. We do not use plastics. Try to reduce the plastic globally. As being with such climate change things happening, so many things happening, reduce the bulk of plastics, because microplastics is definitely bad for your bodies. People are encompassing a lot of metabolic disorders nowadays, and that can be because of these microplastics which are entering in our body. So try using more healthier solutions in and around your life, and that is important.
right, doctor, thank you so much. And that brings us to the end of today's cancer awareness session. On behalf of Future Risk Insurance, I'd like to thank Dr. Tanika again for her time and for her valuable insights. And thank you all for joining us today. Let's carry forward what we've learned today and work towards a better tomorrow. Thank you so much, guys. Thank you, Dr. Kanika, for joining us today.
Most welcome.